Welcome to the Apostolic Forum. I'm Dana Thompson, and today we have an exciting show for you. We're living in times where we have to know the times and the season in which we're living in, that the information that's been conveyed to us and the information that we're conveying is correct. So our topic today is healthcare. We're hearing a lot of things about healthcare. Therefore, we have invited two guests who I feel will enlighten not only me, but enlighten you on this particular topic. And our guest today is a good friend of mine, Pastor Kenneth Jones. How are you, Kenneth?
I'm doing great. My name, of course, is Kenneth Jones. I am a senior pastor, and I am also a public school teacher for Wicomico County Public Schools. One of the things that has really got me interested in the subject of healthcare was actually not the things that you're hearing in the news about poor health care or people who have no health care or people who lost their health care. It was actually good health care that has me here today. I'm one of the American citizens who actually has great health care. And so when the debate began to rage concerning health care, I found myself really in a place of apathy. Because at the end of the day, no matter where the debate went, I went home to good health care. And so I understood that that was a very dangerous place for me to be operating in. It was a very dangerous place for me to be in a place of apathy, for me to be in a place where I wasn't informed. And it was reconnecting with a good friend of mine, Dr. Thomas Levis, who really inspired me to begin reading blogs, who inspired me to begin reading various articles, so that I could be informed about the debate. And so I began informing myself. I actually went online to the 1,018-page bill, something I hadn't done in the past, but he really sparked my interest. And as a pastor, as a public school teacher, it's important that we have an understanding and that we're able to grasp the information, the jargon, all of these things that are going on. And we as American citizens need to know what's going on, because I believe that both sides of the debate from time to time are giving information that if we don't have a good solid handling on the facts and the issues, we can be swayed into believing something that's not true. Well,
thank you for sharing that, Kenneth, because that's 100% true. You know, Hosea 4:6 says, "My people perish for lack of knowledge." And it's good to know that your good friend is here with us today, the good friend you're referring to. Thank you so much for being able to join us, Dr. Levis. Why don't you, since this is your first time being on the broadcast, tell us a little bit about yourself.
Well, my name is Dr. Thomas Levis. I'm a professor at the Johns Hopkins School of Public Health. I'm a professor of health policy and management, and also director of the Hopkins Center for Health Disparities Solutions. So I teach classes and do research on health policy. In fact, I teach the introductory course at Johns Hopkins in the PhD and a master's program in health policy. So if you come there, the first person you're going to see the first day of class is going to be me. So I'm happy to be here and talk to you about healthcare reform and answer any questions you may have about the topic.
Now, how long have you been actually researching this topic of healthcare?
Well, see, I've been on the faculty at Johns Hopkins for 19 years, but before that, I was at University of Michigan School of Public Health for 2. So I guess I'd say about 21 years I've been in the healthcare industry and doing research on health policy.
Wow. Well, thank you so much for coming on the Apostolic Forum today. Well, Kenneth and I have really been communicating. Kenneth is like one of my comrades in the Lord, best friends in Christ, you know, any of those terms you can deem as two people who really have a great soul tie and a love for the Lord. And we always discuss current topics, Kenneth and I, and when he mentioned healthcare, you know, of course, I'm really politically in tune. I'm one who follow the political arena, you know, from the standpoint of, you know, the decisions that's being made in our nation, and also very interested in what the quote-unquote conservative right wing is believing on certain topics, and quote-unquote what the liberal left wing is believing on certain topics, to the very middle moderate is believing. And I think that what we're discussing here today is not only important to a liberal or a moderate or conservative, but I think to the common man, because I think the whole basis of this health care bill, from what I'm seeing, from what I'm reading, it has to do with looking out for those who cannot look out for themselves. If you want to classify that as poor, you can. But Kenneth, I'm going to just turn it over to you from the standpoint of you ask some very common, what I consider common man questions to Dr. Levice that you sort of had certain opinions upon. And then from receiving the insights from Dr. Levice, it had you to go back and research further. Can you explain that?
Yes. Basically, a lot of the debate that was going on was beginning to formulate certain questions in my mind as I listened to the debate. Clear that I didn't understand jargon. I was clear that I didn't understand terminology. But I really had a heart to understand. And the debate is raging here in this nation, and I said, my God, it's almost too late to go take a course to get this stuff. And so I was so fortunate to be connected to Dr. Levice, who could actually bring great insight to me. And I'd like to offer him at this time one of the first questions that I had asked him. I think it was on your website, I'm not sure, and he gave me such insightful information. But the first question that I would like to ask you is the one that I've already asked, but I believe it'll benefit so many people that are going to hear it. And that is, why can't the government merely focus on those who don't have health care and allow those of us that have coverage to continue enjoying what we already have?
So to answer that question, let me first kind of give you an overview of how the U.S. healthcare system is set up.
Sure.
Right. So basically, you have, and I think this is a big part of the confusion. You have healthcare financing, which is how we pay for healthcare, and then you have healthcare delivery, which is the actual providing of the care, the physicians, the nurses, the people that actually care for you at the hospital. So most of this debate is really about financing. How do we pay for it? Not how do we deliver care. But because we continue, and I think perhaps some are doing it intentionally to confuse the two and put them together, we have people concerned that the government is going to take over health care, or that the government is going to be involved in decision making about your health care rather than the health financing. So there are really, if you look at countries throughout the world, there are basically three approaches to financing health care. One approach is what they do in Canada. And in Canada, every citizen pays taxes. And as a right of being a citizen and paying being a citizen, you get an insurance card. That insurance card allows you to go to any healthcare provider in Canada and get care. Anytime. Whether you're in your home city or if you're visiting another part of Canada, you can use that card and you can get care. And everyone is in the same system. So they have a public financing program, but the doctors and the hospitals are all private. Okay. In England, they have a different system. They have public health care and public health financing. So again, everyone pays the taxes. You get a card, and that card allows you to go anywhere in the UK and get care. But the doctors are employees of the government, and the hospitals are owned by the government. Okay, that's the second approach. The third approach is to use private insurance, which is what they do in Germany. People purchase a policy, like you purchase your auto policy, and with that policy, it gives you the right to go to certain providers and get care. What we do in this country is we do a combination of all of that. We do all three. We do have, and this is one of the things that I think has not come out clearly in the public. We do have a Canadian-style system in the United States that is called Medicare. If you're over 65 years old, you're eligible for Medicare, which it doesn't matter what your income is. You can be, a multi-billionaire, or you can be the poorest man in the country. Every American citizen gets access to Medicare. That means you get a card,